Hello. It's kind of been a while, a few weeks since my first post. Since I was diagnosed, I just needed some time to kind of process everything. A lot's been going on since my first post. Had a lot of appointments, phone calls, testing, things like that. So, just kind of needed some time to kind of figure out in my head what's going on, process everything, kind of spend some time with my kids, things like that. So, just kind of a recap reminder. On December 1st, I was diagnosed with um, invasive ductal carcinoma. It was accidentally found during an ER visit in my right breast. They found it on a CAT scan. Initially, when they found it, they said that it was about zero point 0.7 centimeters, I think. When they first found it, it was small. Um, I wouldn't have even noticed it myself. I do self exams, things like that, because my mother had breast cancer and passed away with breast cancer when she was 35. So I knew I had a history of breast cancer. So I did do self exams and mammograms, things like that. Unfortunately, didn't stay on top of the mammograms as much as I should have. So just awareness for that. Don't let that slide. You've got to stay on top of that. It was my fault for not staying on top of it. I had the BRAC testing done. It was negative, so I was kind of in one of those denial phases, I guess, that kind of stuff only happens in movies. It's not going to happen to me. Those type of delusions. So, big mistake there. So, because if I wouldn't have had this CAT scan, I don't know if and when I ever would have found it. So, mammograms, very important. Stay on top of it. Um, so they found it. It was small. I wouldn't have even felt it or found it on my own because, breast tissue can be kind of lumpy, dense, things like that. So even when the doctor pointed it out to me and I tried to feel for it, it's still hard for me to find it. So I wouldn't have found it on the self exam. Um, but since then, since my post, I've got a whole slew of team of doctors. I have a medical oncologist, a surgical oncologist, a radiology oncologist. I have a plastic surgeon. I have a geneticist or a nurse practitioner is doing genetic testing on me. So a lot of people working with me for me and in my journey, and they've been absolutely amazing. Very wonderful people, very nice. They've been, very helpful on explaining things, making sure that I'm aware. I have a nurse that works with me. I think she calls herself like a oncology navigator, and she's been amazing. She texts me, she lets me text her if I have any questions or think of anything. So that's been really awesome and helpful. So I don't ever feel like lost or kind of wondering what's going on, things like that. So met with my surgical oncologist first. My boys did come with me for my first visit, which was, I kind of questioned it a little bit. Um, as a mom, I, want to protect them. And, even though my kids always yell at me about being honest with them about when I'm not feeling well or being sick or having issues, because I've had some health issues over the past few years. So I promised them that I would not hide anything from them. But having them come to the doctor's visit and things like that for me um, was hard because they were hearing things directly from the doctor. And if it was at least coming from me, then I could kind of navigate what I want them to hear. I would still tell them the truth. I wasn't going to hide anything from them, but I could control the delivery of it, and how it was being told to them. But they did very well. My youngest, I think, even though he's 14, I think he still, was having some issues kind of really understanding, not really knowing what the doctor was saying. But my oldest is 19 and he asked a lot of questions. It was kind of cute, actually. He was taking notes and, he made sure that he asked the doctor questions that he wanted to know and things like that. So, from what I didn't really get too much information from the surgical oncologist, but what I did find out is that my tumor, they are calling it, or were calling it at that point, earlier this month, a stage 1A invasive ductal carcinoma tumor, and it was positive for estrogen and progesterone, which, I used to be in the medical field and things like that, but on this side of things, I'm not super familiar with it. But I've kind of read and done research that's a good thing, that it is positive for those hormones, and it was HER2 negative, which is a good thing. So they were saying the good news is that it doesn't seem aggressive from what they can tell, and it seems like it's slow growing. So those were some, good things that we had found, and I got I called it my breast cancer binder. I had a lot of information in it about, surgical possibilities, procedures, what to expect, some things about the hormones information, and then in the back they did have some support group information and opportunities, which, I would like to at some point take advantage of and be able to go to and participate in. So then she did had another mammogram and ultrasound done while I was there to, I guess, compare from the first one. And then I went and saw my medical oncologist, and not too much information from her that I didn't already have. She just wanted to talk to me about, possibilities for treatment after the surgery. And right now we're kind of looking at 4 weeks of radiation every day for 15 minutes a day, maybe a little bit more, but as of right now, probably only about 4 weeks. May or may not have to do cancer. That ball is still kind of, or not cancer, sorry, chemo. That ball is still kind of up in the air. They're waiting on a few other test results to come back, and then they'll make that final decision after they do the biopsy of the tumor itself, after or during surgery. There's a ONC score, ONC score, that kind of determines the likelihood of reoccurrence and things like that. And from there, they'll decide if I need to do 1 or 2 rounds of chemo. Hopefully that'll be it for that. And then since it was positive for estrogen and progesterone after surgery and after radiation, I'll be on hormone therapy for about 5 to 10 years. So I kind of had some questions for her about that, because, if they're going to decrease my estrogen, does that mean it's going to raise my testosterone? And am I going to grow facial hair? Am I, gonna, my voice going to get deeper? Those types of things. And so she said that the likelihood of that is pretty small. So that's good news. So hopefully, to keep the hormone levels low, it will kind of block the estrogen and progesterone from being produced by the adrenal glands, and then the ovaries. But the thing is, I'm 42, so I'm still kind of on that borderline of menopause, but for the past 5 years or so, I haven't had a cycle. So, which I always saw as a good thing because it didn't have to deal with that. But I've also had hot flashes and, hormone fluctuations. So, I had some testing done, some blood work done to check on my status for menopause. And the results today, I was talking with my nurse, and they came back kind of inconclusive. So they didn't really match up to what they should be to diagnose or to officially say I have menopause. So I had spoke with my medical oncologist about that. And, she and I both talked about the possibility of just taking my ovaries out and, as a preventative measure to, not have to take like tamoxifen or some other drugs for reducing my, hormone levels because of the side effects and the adverse side effects of those. And since I'm 42, I have no intentions of having any more kids. And since I am a little bit older, having the ovaries and stuff be removed wouldn't be a huge issue. And it's just a laparoscopic procedure, very minor procedure. So I think we're leaning towards doing that. So we'll have to see later on if we're gonna, maybe after the surgery and stuff, if we're going to do that. So there's the surgical oncologist, medical oncologist, and then I met with my radiologist, radiology oncologist, and she and I only talked for about an hour, so she just got some information and just basically told me what I already knew from speaking to my other doctors. She kind of gave me some information on what to expect during radiation, after radiation, and things like that if we went ahead and, how many weeks and stuff we do of that. But I ended up having to have an MRI. So I have a pain pump in my abdomen for my chronic pancreatitis, and they were unsure if I was going to be able to even have an MRI because of the pump. So I spoke with my pain management doctor, and my pump is MRI compatible. So I was on the fence about having that done because there was a risk of my pump stalling. And if my pump stalls, then it could make me really sick because I'm used to getting the medication through my spinal cord. And if the medication stops, it can cause some issues and cause me a lot of pain. So I was kind of on the fence of doing that, but I ended up thinking about it, and I was just like, well, I think, the risk, the benefits of doing the MRI outweigh the risk, because I would really regret it and always wonder and question myself, what if I had had the MRI? Would we have found this? Would we have been able to get in front of this, certain things? So I went ahead and did the MRI, and I am glad I did, because initially they thought my tumor was only about 0.7 centimeters. Turns out it's just under 3 centimeters in size. So it was 2.8 centimeters. Most of it is kind of hiding in the fatty tissue, almost down to the chest wall. So the CT and the mammogram and sonogram didn't pick up the about 90% of the tumor. So good thing we did the MRI so that they could find that. But that kind of went from the more of a possibility of doing just a lumpectomy only is kind of going off the table, because my surgical oncologist said that she doesn't think that I would be happy with the way things looked after the lumpectomy only, because, us as women know that our breasts tend to have one bigger than the other, and my right breast is probably about half the size of my left one. And she said with as much tissue and stuff that they would have to take out, that she doesn't think I would be happy with the way things looked. So we're leaning towards a mastectomy on that side. I don't know. I'm still struggling with that decision. I think I would rather it be just a scar than have like a weird shaped boob. But at the same time, I'm struggling with the emotional aftermath of having that done. It's not anything I haven't seen before, because my mom, like I said, my mom had one and I had seen her scars, but I don't know. So I'm kind of curious if anybody else has had to have a mastectomy or decide between it, and how they made their decision on what was best for them. Um, Part of me, the bigger part of me is like, just chop it off. Just chop it off. It would be better to just not have it and not have to worry about that side anymore. But I don't know. I don't think it's as easy as that. I think, I guess easier said than done type of thing. So I'll make my decision after I speak with my plastic surgeon. So I'm going to talk with her and see if there's an option for reconstruction. I've been doing some research online, that maybe I could get a bonus and have her take some of the fat out of my stomach and move it to my boob. Or if there's a possibility of an implant to make them both look. I don't care if it's a little bit smaller or even half the size like it is now. I don't need them to be perfect, but seeing if that's a possibility. But I think if it's not, again, I'm struggling with it, but I think I'm just gonna go with the mastectomy. But we'll see. So things I'm kind of waiting on still right now. I have my appointment with my plastic surgeon on Friday. So we'll be able to talk with her then and figure out what kind of surgery we want to do. And then I'm still waiting on my genetic results. So kind of like with the family tree thing that you can do in genetic testing thing. I can't remember what it's called, but you just kind of spit in a tube, kind of like the BRAC testing, and then you send it off and they test you for like 81 different genes to see if you have any hereditary traits for other types of cancer, so we can maybe get in front of that, if there's any likelihood of a reoccurrence. If I do test positive for any other cancer genes, my boys can get tested for free, so that's nice. To see if there's anything we can do preventative wise for them if they test positive for anything. So I'm waiting on the genetic results and then my plastic surgeon appointment on Friday. And then my surgery should be, I think it's going to be January 18th. The nurse seems to think whether I go with a lumpectomy or a mastectomy, that date should still be the date no matter which one I choose. But we'll find out 100% after I have my plastic surgeon appointment. And then I go in on January 16th for, they said about an hour and a half of pre-surgical testing, imaging, blood work, things like that, so they can have current images and stuff for the surgery. I think the surgery will probably be about an hour and a half. And I don't know if I have a mastectomy, if I'll get to go home the same day, possibly, or if they'll want to hold me at least a night for observation. I'm not sure. But that's kind of an update of what's going on right now. But I'd be interested to hear if anybody else is going through anything right now. If you are going through the beginning stages of cancer diagnosis and surgical, treatment or radiation, or have had chemo or anything like that, just to kind of see, what I could maybe expect from those things, recovery time, things like that. So, my son should be coming up for my surgery to kind of help out with my younger son and just to kind of help out around the house. And then, I have a coworker a friend, that I work with, that he should be coming to kind of help out. And I think the boys are going to be wearing breast cancer shirts on surgery day. And if they do, I'll try to remember to post a video real quick before surgery of everybody in their shirts and things like that. And then I'll try and be better about posting more now after doctor visits and after surgery and during recovery and treatment and things like that, now that I've kind of had a chance to get some more information and process things more. And so I already got a pretty cool shirt. I'm a Disney freak, love Disney, but it says Ohana means family, which means family means nobody fights alone. So I definitely don't feel like I'm fighting alone. A lot of the people at work have been very supportive. My kids have been very supportive. So is family, my neighbor, a lot of people have been really awesome, making me feel special. And so I'm hoping to be able to talk with or communicate with other people who are dealing with cancer and breast cancer. So just kind of now trying to figure out a support group. And because I still have moments, like I have moments right now where I feel fine, not struggling too much emotionally, but then I'll have moments where I'm crying, and I'll have moments where I'm upset, and I'll have moments that I'm angry. I have moments where I'm scared. um, I have moments where I just don't know what to think or feel. So it'd be nice to have some people to be able to just talk with and just have that support system of people who know what I'm going through and have lived through it and been through it or are going through it. And so we can just be that, support system for each other. So, again, my next appointment isn't until Friday, so I will try and post a video after I have my appointment with my plastic surgeon. But if you watch this video, please like or subscribe so I can know to post more. And feel free to comment in the comment section below. I figured out how to turn it on. Until then, I hope you guys had a blessed and Merry Christmas. And as my sons and I say, let's fight on.